Yeah, that's the numbing medicine. You're good. All right. I need your help. Dr. Berndes, you're center stage. Dr. Deuk Majan, we are at the Deuk Spine Institute. We are performing our final surgery for today on a gentleman who has suffered with back pain for how long, folks? Lay still, you can't move. 10 years. 10 years, all right. And today we're going to be fixing that back pain. Now his pain is coming from two sources. Lay still, you're doing all right. One of them is his disc, the L3-S1. The other is the facet joints. You're fine.
That's why he's tightening down.
Huh?
Don't move.
Is that where you normally feel it? Shot? All right. You're good. That's just your muscles. You're okay. Shot. Okay. Part of the issue is he's moving, so it makes it a little challenging in terms of lining up the x-ray. You're okay. You're doing great. We're all right. We've done this a few times. A few thousand times. Yeah, don't move. Shot. You're doing great. Let's get an AP. So our patient has 3 bad discs. Actually, I think 3 or 4. Maybe 4, but only 3 of them are causing symptoms, we believe. The L3-S1, the L4-5, the L3-4. You're doing great. Beautiful. All right. We're happy with that. Shot. 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 Okay, so I'm trying to get into 5-1. Let's wag a little bit. And I think we're off on wag by maybe a degree, and we're off on orbit by a degree. I think that's better on the wag, right? And then, yeah, and then the orbit, we're off by still a degree. Shot. Yeah, other way. That's nice right there. That's perfect. Look at that. Gosh. So why don't you show our audience, Jordan, what we're looking at here. Shot. Yeah. Don't move. Yeah, we're looking at the disc. We're looking at the pedicle. And we're looking at the facet. Shot. I'm going to give him a little bit more numbing medicine, and we're going to make our incision. It will be 7 millimeters, basically big enough to put the tube in for the endoscopic tubular retractor. Lay still, you're doing great. And through this incision, we're going to make our second needle pass, which will be in the L4-5. Everyone agree? 4-5, 3-4, 5-1. 3-4, 4-5, 5-1. Shot? Everything okay?
Yep.
Shot?
Sure, try to keep your hands still, my friend.
He's fine. There's a little bit of movement. Shot, it's fine.
Ask him if he's feeling it, where he's feeling that.
No point, because he's probably out.
No,
Yeah, I'm staying way away from the nerves. I'm going low in the foramen. I probably could be a little bit more medial on that one. Let's see. Give me a lateral.
I just sometimes don't know when to ask and when not to ask.
About what? Shot? Yeah. Thank you, though. Lay still. That's his facet. He doesn't like it. Shot. Shot. That's one of the painful discs, so it's really bothering him. AP. I want to verify on the AP that we're in the right spot. So he's traveled to us from Texas for back pain. He's had for a long time. I was talking to him in the clinic. You can see the pain on his face. He's had it for so long, and it's just consumed his life. And he didn't know where to go. He found Deuk Spine, and now we're going to get rid of that back pain once and for all. No, really nice man. Can't give you too many details because of anonymity of the patient, but his job, you know, he needs to be on it to do his job. And when you're in pain all the time, shot, it's kind of hard to do your job, right? Because you're distracted with pain. Shot. So far, everything's going real well for him. AP, we're almost done with the needle placement. So we need him awake in a few minutes. Notice how I've stayed very low in the foramen at each level with the needle. I'm staying far away from the exiting nerve root. We've infiltrated his skin quite a bit. He has the peau d'orange, orange peel, which is characteristic of a good subcutaneous infiltration. Huh? Where do you feel that? Where do you feel that?
Where's that going?
In the pain area, in the pain area, in his back. All right, you're doing great. You're doing great. So, folks, here's the thing everyone needs to understand. Henry, we got an audience?
Yes, yes.
All right. Here's what we need to understand. There are 30 causes of back pain. 30. We know all of them at Deuk Spine. You have discs, 5 of them in your lower back. There are facet joints. Again, 5 on each side. You have bones that can fracture, 5 of them. You have the SI joints. Whoop. Let's see. Here and here, sorry. SI joints, your tailbone. You have your coccyx. You have your piriformis muscles, which are here on the side. And those are the main things. There's some other minor things that can happen, but these are the main causes, right, out of the 30. Right? So basically that's 10, 20, 1, 2, 3, 4, 5. 25 are common. The other 5 are not so common. And for him, I believe he has pain at the disc at L3-S1, L4-5, and L3-4, based on his MRI and the location of his pain in his back. But he also has sacroiliac joint pain. Don't move.
Stay still, my friend. Okay?
You're doing great.
You're doing great. We're almost ready to put you to sleep and do your surgery, but I need your cooperation. Okay? How long has he had back pain for?
10 years.
All right. We have another 10 years of back pain. Lower, can you see this, Henry? No?
Yes, we.
Lower back pain, 10 years.
Yeah, we see.
All right. Are you comfy?
Are you comfortable? How you doing, buddy? You alright? Yeah.
So when we put patients to sleep like this, just to put the needles in, we give them what's called propofol. And propofol makes you sleepy, but it doesn't take pain away. So it's not a pain medicine. It's just a sleepy medicine. So once it wears off enough that he's awake, he's going to start, you know, being able to feel any pain that he might have. Are you comfortable? Are you comfortable?
Yeah.
How bad is it on a scale of 1 to 10? Is that where you get back pain? Did you hear him yell, Henry?
Yeah, we did.
Yeah, he went, ah, right? I didn't tell him when I was injecting, but he tightened his back up. He yelled, that means that disc is painful. That was L3-4, and that was a 10 out of 10. It's also concordant. That means it's where he gets his back pain every day. Look at the tear on that thing. It's massive. We're going to fix it today. See the tear? That's where the arrow is. Circle the tear, the black thing. Yeah, there you go.
We see it.
Lay still. You're going to be great. We just checked one of those discs, and sure enough, it's causing your pain. Are you better now? Any pain? He knows what's coming, right? He's a smart man. How bad is that on a scale of 1 to 10?
Give us a number. 10.
Is that where you get back pain? That pain's going to be gone for the rest of your life. Isn't that wonderful? You're welcome. You're welcome. Just take it easy. You're okay. Let me know if it's better. Is it better? Is it better? All right, so you can see the tears at both of those discs. Let me know, is it better now? Huh? All right. So it's gone. How bad is that on a scale of 1 to 10? Huh? 10. All right, that was L3-S1. That was the one you almost didn't do. 10 out of 10. Is that where you get pain typically? Yeah. It's a good thing we're fixing it. You trusted me, and we're going to get all that pain gone. It's going to be like a miracle. I know, it radiates your crotch. That's called referred pain, you know? So you're good. We didn't touch your crotch. We're just back here working on your discs. Good news is when we're done, all that pain will be gone. You ready for it to be gone? Yep. You get to go to sleep, my friend, and when you wake up, that pain's going to be gone. All right, so for those of you watching, we just verified that 3 discs are literally causing his back pain. 3, 4, 4, 5, 5, 1. Plus, we have